Good afternoon, Jennifer. This is fun. This is
Yeah,
session two of our medical billing and our workflow. So I'll
yes.
let you start it off.
Yes, well, welcome everyone to our Medical Billing Decoded series. My name is Jennifer Griffin. I'm a clinical pharmacist for Harps Food Stores. At Harps, I specialize in medical billing, point of care testing and treatment workflow, protocol writing and implementation, and marketing our clinical services.
I'm Dwayne Jones. I'm the regional supervisor for the pharmacy division and a clinical program director. And I get the opportunity to work with Jennifer on this great program. And we're excited to share with you today workflow. It's so important. It's the key to everything that's successful and efficiencies in your pharmacy. So, Jennifer, I will let you start your piece of this because I think it's so important. Jennifer's been with us since the beginning of her career in pharmacy, actually, when she was in pharmacy school doing rotations with us. So she's been at the grassroots of so many things that we've done within our program and understands the value of workflow and how that's important in keeping efficiencies and letting your pharmacists free up to have more time to do clinical programs.
Well, thank you, Dwayne. And I felt like we had a really good last conversation talking about just where the profession of pharmacy's been, how it's evolved, and just what it's looking like now, and how we believe that medical billing is going to be the future of pharmacy, as our scope of practice continues to grow. So I'm excited to transition today into workflow foundations. If a pharmacy doesn't have a strong workflow in place prior to implementing these enhanced clinical services, it can feel difficult and burdensome, but it doesn't have to be that way. So that's what we're going to talk about today, is discussing the importance of a solid workflow and what it can look like in your pharmacy. So, Dwayne, in all the years that I've known you, you're super passionate about discussing workflow, and you set so many pharmacies up for success by overhauling an old workflow. So, why is it so important to have a solid workflow in the pharmacy before we start implementing medical billing and all these additional services?
It's critical, Jennifer. It's critical. And to your point, we talked about the why in the last series, and this is the future of pharmacy. And the why is because we've got to get ready. I mentioned this before in one of the seminars that we were doing that COVID was great for us, but we would all have loved to have had maybe 6 months, a year to get ready
Yeah.
for that. So now's the time to get ready, and so get ready for the future. Workflow is so critical. I've walked into so many operations over the years, and they seem to be so incredibly busy, just back and forth, chasing things. And I'm like, well, let's stop here and put some pragmatic processes in place, and let's identify areas of responsibility for our technicians and start delegating non-clinical duties to our technicians. Give them responsibility, give them roles, and let's process this as seamlessly as we can throughout the system. And it goes back to even something as basic as making sure that your workflow flows. I mean, actually goes from receiving a prescription to the point that you drop it off so that you're not colliding with each other. Those seem really obvious, but there's so many times I've had to go in to pharmacy that literally, when we started at Harps, I would go in one pharmacy at a time, and I'd go in at night after they closed, and I would start tearing down operations. I would start moving workstations. I would start setting processes in place so that even steps were in place from the reception all the way to the delivery of the prescription, and then start identifying how can I take workflow off of a pharmacist and delegate it to a technician. And I keep saying this over and over again in all of our presentations, that our technicians want to do more. Legally, they're bound as what they can do in the pharmacy. But if we can give them responsibilities, they just flourish, they grow, feel like that they're part of a team. And in this whole workflow process, you're really creating a team aspect to patient care. And every person has an important role, and they feel that important role. And if I feel like I'm part of the team and I'm an integral part of it, then I actually take more pride in what I'm doing every day at work. And so we're all now operating all for the same reason. Everybody has their identity, but they also are part of this team. You don't have one person telling somebody else what to do, another person telling somebody else what to do. And now you're working together, and you look and help each other out throughout the day so that this workflow doesn't stop and it's very seamless. That's been critical to handling volumes. And I can tell you that we've had stores that have said, "Oh my gosh, it felt like I was filling 500 prescriptions and I only filled 150. And
Yeah.
now I can fill 500 and it feels like I'm only filling 150." So that's so important throughout the day, is to be able to maximize the efficiency of your time. And
Hmm.
that's why this workflow has been so important. And it's very basic at the beginning. But then we took that from, we started immunizations. I said, I want immunizations to look just like a prescription. It does not interrupt our workflow. It's part of it. And we created that just like a prescription all the way through. We data entry it, we verify it, and then we administer it to the patient. So everything is seamless. And then we've taken that all the way through with test and treat, with all the other things that we do. And it's so critically important, like I've said that so many times, because now we can free that pharmacist up. And the technicians start to say, what else can I do?
Yeah.
How can I help you more? And then, especially with test and treat, you've seen that, Jennifer. If I can get the technicians to do the majority of the assessment, the majority of the vitals, they can do all those things. And I've said this, probably said this in the last one, but I want to reiterate this. We want to be practitioners and we want to be providers. We have to act like providers. And when we set our workflow up for clinical, I said, I want to look at our technicians like a physician looks at his nurse. Let
Mhm.
them do this assessment. Let them do the vitals. Bring to me this information. Let me go do my clinical duties. And then I can turn this chart back over to my technician, just like a doctor does to his nurse, and let them continue on with the billing, those processes. And that has worked so well for us. And I think that you can see that, especially now that you've had an opportunity to go into some other pharmacies and help them with medical billing. You can see the value in that. And it's oftentimes we get in the habit of doing things because we've always done it this way. And it's hard for especially pharmacists to let go of some of these responsibilities. And once they do, then they realize this is a much more efficient, much more effective operation than what I had before. I'm
Mhm.
glad that I had the opportunity to do this. And we got some pushback every time we would go into a pharmacy and set this up. We got some pushback because this is uncomfortable. I'm not used to doing it this way. But now, after you've done this for a month, you ask them, and they would never go back to the way it was before. Never. I hired a pharmacist that had worked for a large company for about 15 to 20 years, and he worked in a lot of different pharmacies, and this is a very large company. And after he'd been with us for about 3 months, he called me and he said, I want to tell you that this is the best workflow system I've ever seen in my life. This is amazing what we can do throughout the day and all the things we can do. And there's no hiccups because everybody knows their responsibilities. When I very first started working through workflow and setting these up, and I set them up for a very large corporation at one point, and I said, if I can teach my technicians their responsibilities and what they do throughout the day, I can put any pharmacist in here. Doesn't matter what pharmacist I put in, and this operation is going to work flawlessly every day, the same way every day, regardless of
Mhm.
who's at the helm. As the manager, that support is going to be for him every single day, and those technicians are going to flourish because now it's my pharmacy.
Mhm.
This is how we do things, and it's all protocol driven so that every pharmacy works the same way. So that's what we're trying to share with everyone else, is that if you don't have this in place, then model this. We're willing to help you and to share this with you because it's going to support you in so many different levels. You're going to have to give up some of the control. You're going to have to give up some of the things that you're doing. But oftentimes we find pharmacists doing things that they never went to school to do. I mean, you didn't learn how to do data entry or be on a phone with an insurance company whenever you were in school, and you shouldn't be doing it today. There's times when it's a necessity, but it shouldn't be your standard operating procedure. Your standard operating procedure should be delegating that to your staff and letting your staff do it in a workflow manner. And so we've been our own worst enemies often in the past as we've tried to be all things to all people at all times. And that's a great prescription for failure. Never had anybody tell me that that's a great prescription for success, because you have to identify where your strengths are, where your weaknesses are, and let somebody else that has strengths take over what your weaknesses are and free you up to be more effective and more productive in your workplace. And I think that that's true not only for the pharmacists but also for the technicians. We all want some guidance and direction in our life. We all want to know what's expected of us. And if we walk in every day knowing what that expectation is, knowing what that role is, it's just common sense. We just flourish. And it's been that way. And our techs are happy with what they're doing and they like the process we have in place.
Hmm. And like you kind of hit on, like this is a successful workflow that's been implemented over and over and over again. We mentioned in the first episode that we have 39 pharmacies across 3 states. And we tell people all the time, like, it's the same workflow in all of our pharmacies. And keep in mind that all these pharmacies have different layouts. We have different amounts of space available to provide our clinical services, to do just the normal dispensing tasks. Each pharmacy has different prescription volume. Some pharmacies do double, triple what others do. And of course, we have varying personnel. So we have different personalities in each pharmacy, but our workflow stays the same. And I mean, I can vouch for that as somebody that works in multiple of our pharmacies. I can go in and I can still provide the same clinical services and the same quality, the same level of care as I do in any other of our pharmacies. And Dwayne, you know that too, since you also work in many, many of our pharmacies.
So, and you just had an opportunity to work with a couple of pharmacies in establishing workflow and medical billing workflow. And you can see that you came back and you made some recommendations that would help them and help them be more efficient in their programs. So that's really what we want the takeaway to be from this particular session, is for you
Hmm.
to ask yourself, what can I do in my workflow? Because there's always room for improvement in every organization. We still think
Hmm.
that today. We still analyze our workflows. We still analyze our processes. All of our medical billing, all of our clinical programs that we do, Jennifer, is you create the protocols for them. We actually work in the pharmacies and we see how this is going to work flow before
Hmm.
we start developing out how we're going to send this out and train our staff, because that's one of the key components also is you develop a standard operating procedure and then you train your staff on it. It's so important for them to sit down, if I get a new technician, to understand the responsibilities of each workflow step and
Hmm.
understand their responsibility in this. And then
Exactly.
you have to be some flexible too, because I mean, we have drive-throughs in our pharmacies. And so who's going to get the drive-through? Well, if we're working together as a team and I can see that this person is in the middle of dispensing and has several different prescriptions, the last thing I want my technicians to do is to stop in the middle of what they're doing and go do a task like run a register, run the drive-through. And somebody else can look over and say, oh, they're busy. Let me go do that. And then you work in unison with each other. And then it becomes like an orchestrated process throughout the day. It
Yeah,
works.
it does. It does. And we've already like talked so much about technician empowerment. Um, but I mean, that's going to be an overarching theme. And so when we start getting into the meat and potatoes of medical billing and the whole revenue cycle management process, you're going to hear us say multiple times, like, every non-clinical task can and should be delegated to a technician. And sometimes we hear Dwayne pharmacists say, like, well, I just don't have the staff to medical bill or provide these services. And our answer or our question back to them is, well, how is your workflow? How are you currently utilizing your technician staff? And we can say that when we started medical billing for clinical services in our pharmacies, we didn't have to hire any extra staff. And that's because the workflow was implemented correctly. Um, and we properly trained and equipped our technicians. We gave them all the tools that they needed to be successful.
tell you, it's difficult letting go. I mean, it's difficult delegating. I'm not going to say that it's an easy task. It's a difficult thing to do, and I'm probably the worst was the worst culprit of that in the beginning because you want things to be accurate. As pharmacists, we don't allow ourselves a margin of
Hmm.
error. We want everything to be perfect, and we think that we have to do it all ourselves. But I learned really quickly that it may take me some time to teach somebody and they may make a mistake in that process. I'm going to be the one who ultimately looks at that and correct that error. But the time that you correct an error and they make a mistake, that's a learning opportunity. So
Hmm.
the opportunity there is to say, well, this is what you want to do so that it doesn't happen again. You
Hmm.
do that a few times, and the technicians are now knowledgeable. And then all of us, after you spend some time training your techs, working with your techs, and investing your time in that, you're not wasting your time. You're investing your time in your future. And then when it all comes together, it's like, oh my gosh, this is really great. Now I have time to do, I can trust these people that they've been trained properly
Hmm.
and that they're actually doing their duties, things that I was doing that I was really wasting my time. And I have pharmacists say, well, I don't have time to do that. I'm like, well, I don't know how you have time to do the things you're doing. Because if you were to delegate it properly and you had your staff trained properly, you would have plenty of time to do all these clinical services and work with these patients.
Hmm.
It is a tried, proven process that actually works. What we have to do is get beyond ourselves and say, okay, I'm going to do it. I'm going to do. I know we were in one meeting and I had one of the pharmacists say, well, my technicians are not capable of doing that. I'm like, well, I beg to differ. They are capable of doing that. You just haven't taken the time to train them to do that.
Right.
So, because what you're doing with data entry is not something that clinically is a great challenge for you. It's just something that you picked up to do because probably if you started your pharmacy, you were the only person there at the beginning. I was there. So I had to do everything myself until I hired somebody. And then I hired somebody just to take off some of the load. Then I realized this person's capable of doing all these other things because it's not rocket science what they're doing. It's just a teaching process and a learning process. And once they learn it, they're not going to forget it. And the beautiful thing about that is once I teach them how to do one thing, and then I teach them to do something else, that can always teach them more because now they become so proficient in it that they also have time. And then I've got another technician and they can work together. When we first started laying out our clinical programs, we said we're going to have some clinical time for one of our pharmacists. I mean, for one of our technicians, not our pharmacists, but our technicians. So we started allotting 2 hours during the day for one of those technicians to do nothing but just clinical services, whether that's documentation, whether that's billing, and that person does that for that 2 hours of the day. Now, if somebody calls in sick, obviously you have to make some adjustments in that time, but the next day that person goes and takes care of that. And as you've proven that once you get the medical billing process in place, you've got your workflow in place, and once you're really efficient, that whenever it comes to revenue cycle management, it's not this daunting task that's going to take you all week to do.
Hmm.
You've proven that you can go through and do revenue cycle management within about an hour, 2 hours once a week.
Once a week. Yeah.
It's because you've got workflows in place and you have efficiencies in place. And that's the key. That's why this is so ultimately important in every aspect of your business. And once you start employing it from your technicians, from just routine everyday processes in your pharmacy, then it flows through on every other thing that comes about. And like I said, the reason why this is so extremely important today is the why we were saying is because the industry is changing rapidly. What we're seeing, you and I, Jennifer, are seeing today is that there's more request and there's more interest in paying pharmacies to do these services and to provide more services, to provide diabetes counseling, to provide hypertensive counseling, to be more involved in patient care. And it goes back to what we said in the first episode. We're an access point. There's a huge shortage of providers in this country. There's a huge shortage of care, especially in rural America. And we're going to be destination points for those services as we get into the next decade and beyond. 27 is going to look so much more different than 26. There's going to be so many more opportunities in 27, 28 than what we've ever had to be interact with patients and close care gaps. What I'm seeing today with some of the advisory councils I'm sitting on, the people I'm talking to, is that we may not think that we've had a tremendous impact on that patient, but what the plans see is that, oh my goodness, this patient is healthier. We're getting reduction in emergency visits. We're getting reduction in hospital visits. And most importantly, the patient's a healthier patient. They're in control of their disease state now. It's because that pharmacist has been freed up to be able to talk to them. Now, one of the challenges we have going forward in the future that the plans are starting to see is if we were to pay these pharmacists for these services, we can afford to staff our pharmacies. We can afford to have more pharmacies doing these things because right now, oftentimes what we're doing is these are the most overt challenges that we see that a patient needs. I need to go talk to this patient. There's something going on here. There's drug interaction, there's medication, they're out of control. I need to go spend some time with them. If we actually were paid for these services on a routine basis and we could program those through every day, you're going to see in 27, 28 that they're going to attribute patients to us to do these very things. If we have established workflows today, and if we've got the processes in place today, you're in a position to be able to grow your pharmacies in the future because one workflow supports another workflow, supports another program. And now within our pharmacies, we feel like that we can workflow any clinical program that they bring to us today because we're not overwhelmed. We don't get overwhelmed because we do it methodically. And you're going to talk about some of the key sources and resources that they have to be able to even assist even more with workflow.
Mm-hmm. And so we talked about delegating to our technicians. So once we've taken off some of our load, the things that we're doing that should be passed off to a technician, the next thing we need to address is our pharmacists being tied to the verification queue. So if our goal is to free up pharmacist time, it's going to be difficult when the pharmacist is tied to that queue. So whenever I give CEs and I discuss workflow, I use an example of a patient that I know we all have at least one of. Think of that one patient that calls and says they're on their way to the pharmacy and they need you, the pharmacist, to have all 12 of their maintenance medications ready when they arrive. Now imagine if you had a MedSync program. These maintenance medications, they can be planned for. So when that one patient calls, says they're on their way, you can tell them that we already have your prescriptions ready for you. So we're removing the pharmacist from having to urgently verify prescriptions throughout the day. We have these patients who are on MedSync where we can plan for their refills. And so in our pharmacies, I know that whenever a MedSync patient drops into our queue, I have 5 days to finish that up. And so I'm not tied to anything during the day. I can step aside and I can have longer conversations, make those meaningful interventions, Dwayne, that you were talking about. And as a pharmacist, I can say this takes away so much stress.
It takes away stress, but the important thing also is it makes the patient's life more efficient. It makes
Absolutely.
the patient much more. Now they're not waiting, making 3 trips back to the pharmacy to get their
Yeah.
prescription, waiting for the doctor to call them back on refills. So all these things were out of stock. So we said if we can take 50% of our business, which is refills, and
Hmm.
make it non-urgent, now we even become more efficient in our operations. And then, well, who runs MedSync? MedSync doesn't free you from work. It's just work that you're doing for your future. Here
Hmm.
again, who runs your MedSync program? It's not the pharmacist. Again, we've taught our technicians, you workflow this, you're investing in your future also. So now they're an integral part of that entire MedSync program. Enrolling the patient in MedSync, keeping them on MedSync. They've got to call 5 days out, 8 days out. Is there any changes? And then if there are, then we can have time to call the doctor, make any changes in that program. And they've run our MedSync program for us. And it's beautiful. Now, when the patient comes in, we have an opportunity to talk to them about adherence. We have opportunity to talk to them about immunizations. We have an opportunity to talk to them about the services that we're offering, whether it's test and treat, whether it's oral contraceptive prescribing, A1C testing. We have an opportunity to interact with that patient. And it's a much more meaningful interaction because we find so many times that the patient's dose has changed doctors taking them off of medication
Mhm.
that we didn't know. And now that we know that, we can call the doctor, make those changes. So overall healthcare is improved for that patient in a MedSync program. Workflow, it is amazing.
It's a game
Was it
changer.
easy to start? It wasn't easy to start, but I said before, anything worthwhile is going to take effort. And so you're investing in your future. 3 months into the first 3 months of MedSync is difficult. Now you imagine this, that you're rolling out a MedSync program that you know that the first 3 months is going to be difficult, and you're rolling it out to 39 pharmacies. So because we have a proven record and because we have workflowed in the past and because we've already delegated this to the technicians, it's not foreign for them to delegate this responsibility to technicians, but we also trained them well. We also had a protocol for it. We developed a protocol for MedSync that followed by every single pharmacy. First 3 months is some effort to get it done, but you can ask any one of our pharmacists today, and they will tell you they'd never go back to the way it was before. I walk into so many of our pharmacies and they tell me, they go, the best thing you've done for us in the last decade was the MedSync program. It's amazing. But it wasn't easy to start. It's
Mhm.
like delegating to technicians is not an easy thing because it's foreign. It's something maybe you haven't done before. Maybe you didn't feel like you could trust them. But once you start developing that trust and then people start performing, then your whole process and your whole pharmacy just absolutely changes. And if you have those Mondays that are just really, really a downpour of prescriptions,
Mhm.
and everybody has those days, they have those Mondays, they have those days where you think, well, not every day is this way. Uh, you don't have to stress because I've got all these prescriptions in MedSync queue that I can leave. I can
Mhm.
do them tomorrow whenever don't have this really robust, crazy day.
Mhm.
And the whole staff feels that way too, as opposed to feeling this chaotic pressure of there's so many demands on my time for every second of every day. I
Mhm.
can breathe. And what we tell our technicians to do, once you get to a mid-sync level and you're pretty well caught up with everything else, now you've got time to do your other duties. You've got time to pull off and do some clinical things. You've got some time to do some other things. Here again, it supports workflow. Workflow supports MedSync. MedSync supports workflow, and it works beautifully. You have to look at your pharmacy almost like an orchestra. You know, how are we going to get all these players to play together to actually make this music that's going to be beneficial to the patients, and they're going to see it when they walk into your pharmacy. They also sense that. They also sense if you are hectic, if you're stressed, and we, speaking of workflow, during COVID, we made the conscious decision that we were going to workflow COVID tests, we were going to workflow COVID immunizations into our system so that it wasn't going to overwhelm us. And then it's amazing that we actually grew our prescription business during that period and afterwards because we weren't overwhelmed. We weren't telling people it was going to be 4 days before I can fill your prescription.
Mhm.
Everything was still processed and we still were able to administer over 30,000 COVID vaccine during that time period, but we did it pragmatically. And we have to keep that thought process in mind. One of the things that I think has haunted us over the year in pharmacies that we really feel like that we have to make sure we don't lose any patients and everybody stays here, that we can take care of every single patient. And so there, that leads to the tendency of being all things to all people at all times. And they don't come to you because you get your prescription out in 10 minutes. They don't come to you because the fact that you can provide things in a timely manner. They come to you because they like your service. And the more they start to see the value of the quality service that you provide, the more people will start to say, I want to do this. I have a great example of a pharmacy that had struggled for 3 years in a row. It was a chaotic operation whenever we stepped in and took it over. And I took one of my students that had worked with me during pharmacy school. She graduated, and I put her at the helm of that pharmacy, managing it. And she knew the workflow. She followed it. She taught her staff. She turned it from losing money into a money-making proposition within 14 months. She actually grew the business because now she was interacting with the patients, interacting with the physicians. She had established herself as a viable source of healthcare in that community, and we grew that business. And that's played out for us many, many times within our operation. And I share that just to show how important it is to focus on patient outcomes, patient care, Sometimes you have people that will leave for various reasons. We've had people that have said, well, it's taking you too long, and they come back in 2 to 3 months and go, I like your service better than what I
Hmm.
had before.
Hmm. Yeah, all of these changes in workflow, it's creating the space for those meaningful clinical interactions. And we promise people whenever we talk about workflow, we're like, we promise if you begin delegating to your technicians, you construct a robust MedSync program, you give longer wait times for filling a prescription. And another one that I like to touch on is having an appointment-based model. Again, being proactive,
So
instead of feeling like you're just putting out fires all day. But we promise people that if you implement these things, you're never going to go back to the old way.
days you're not going to have busy days. That's not to say that you're not going to have days
Exactly.
that are hectic. It's just part of the nature of the business. I mean, you're going to have prescriptions, a lot of prescriptions one day that you have to call, make calls onto the
Mhm.
doctor, and have things that you're going to deal with. That's part of the profession. You're going to have problems with insurance. You're going to have problems with patients that are irrational or they're sick, or you're going to have opioid situations you have to deal with because they shouldn't be prescribed, or they have multiple prescribed. That's just normal part of the process. But I'm telling you that the establishing workflows allows you to deal with those issues much more efficiently without quite the chaotic process as you had before, and now you feel more comfortable with it. Everybody in your pharmacy gets the sense that we are a contributing member to this team, and they will support you, and then you
Right.
support your staff.
Yep. Everybody feels supported.
Yeah.
Well, Dwayne, I think our time is up. It was a great conversation. Thank you so much for having it.
It always is a great conversation with you, and it's really great to have this opportunity to share. And as we move more into the details of medical billing, I can tell you, everybody that's watching, you are going to love what Jennifer has to share with you in the future. She has been so instrumental in creating workflow for medical billing and simplifying this process that we think is really hard. It's not. You just have to, here again, get a workflow in place for it. And that's the reason why we've got this series is to go step one, step two, step three. And then whenever Jennifer starts sharing with you how you implement medical billing and have your techs run this program, you understand, wow, yeah, that's why step one was important, two is important, three is important. And then whenever you see what she has to offer you, you're going to be very, very impressed, I promise.
Well, thank you,
So
Dwayne. And our next episode, we're going to be talking about the provider mindset.
yes,
So
absolutely.
that'll be a good one
That's a
to
good
tune
one. And that's
into.
something so critically important for us to start thinking about is thinking of ourselves as a provider and acting as a provider. And it's very rewarding, as you know, once we get that implemented in our programs.
It is. Well, thank you, Dwayne.
Thank you so much. It's been a joy. Thank you all for listening. I look forward to the next series.